satisfactory. So we ask the patient, please close your eyes. Can you take off your glasses?
Mm-hmm.
Okay. So can you pinch one of your nostrils? Okay. And then ask the patient to identify.
Alcohol. Sounds pretty distinct too.
For the
Yes, he does.
We're doing each one, right?
Yep.
Each one a different scent, right?
What is that? Coffee? What is that?
Okay.
Good job.
Regular or decaf?
Right.
I have no idea.
Okay, so that patient was able to identify the objects, substances. Okay, so we go with cranial nerve 2. So we start with the distance vision.
With the glasses or without?
No,
Without?
no.
He can see E, that's about it.
Okay.
That's pretty
So,
much it. Yeah.
20 feet away. Okay, and then we ask the patient, can you please cover one eye? Okay, and then which is the smallest line that you can read very clearly?
E.
Okay, so 20 over 200. Now, can you try to read line 2?
No.
Okay,
FP.
okay, no. Okay, now let's do the other eye. Okay, which line can you read very clearly?
E.
Okay, can you read line 2?
No, I can't.
Okay, all right, so we make sure that this is 20 over 200 for both his eyes. Remember, eyeglasses off.
But he said FP, so does that mean that he
But
go?
there are only 2 letters here. He only read half. So you cannot say that he was able to read it clearly. Remember, we said if it's half of the number of letters, then you have to go back up and that's going to be his.
It's not FP, the second one?
Just
It is
repeat.
FP.
Looks like he wasn't able to read it really clearly. So it's 20 over 200. Now you always need to ask the patient to read the line, the letters below it, to see if he can still read it clearly. If he says it's blurry, then just stick with the first the line above it. Okay. Then we move to okay. So this is for the near vision. How many inches away?
14.
14.
Okay. So we ask the patient, okay, cover one eye. Can you read number 7?
Yes.
Okay. If the patient says yes, can read the biggest on the back. Go to the front. Which box can you read very clearly?
Number 1.
Okay. Can you read the first line?
In the 2nd century of the Christian era, the Empire of Rome comprehended the fairest part of the earth and the most civilized portion of mankind.
Okay. So let's try now the other eye. Okay. Make sure that you don't press on your eye. Okay. Can you read number 7?
Mm-hmm.
Okay. Let's flip it. Which number can you read?
Number 1.
Okay. Again, just one line.
In the 2nd century of the Christian era, the Empire of Rome comprehended the fairest part of the earth.
Okay. So that is for near vision. And then we perform the
This way?
perform here, face me. Confrontation test. Okay. Confrontation test. So first level. Okay. So how many what's the distance between you and the patient for the confrontation?
2 feet, isn't it? 2, 3 feet?
3 to 4 feet.
Oh, 3.
Okay. So we ask the patient, can you cover one eye? What do you do for the confrontation test? Yes. So that's the wiggling finger. So
At 90 or...
hold on. What do you do first? So the patient's eye is covered. What? Do you cover?
when you see the wiggling finger.
Okay, but do you cover your eye? That's the exact.
Oh, you
Yeah,
cover
cover
the
the
same
opposite.
eye. Yeah.
Or, okay.
What? Which
Cover
one
the
take off?
Cover the opposite.
Oh, cover the opposite eye. Okay. So we have the 4 fields. Just look straight ahead. Okay. So this is what? Superior. How many degrees?
70.
So,
No, 50.
50. Good. Okay. Here.
Temporal.
Okay. How many degrees?
60. 70. Oh man.
Hold on.
90.
90.
90.
And
Wait,
hold
so
on.
That was a
50.
test question. 90.
90. And then here, look straight at me.
Nasal.
How many degrees?
60.
60.
Oh man.
Inferior.
40.
50. No, no, no. Yeah.
40.
No, 70.
70.
I'm sorry.
50. 90. 60. 70. Okay. See, if it's a review for the finals.
Yeah,
Okay.
I'm gonna review the eye.
Okay, so again, ask your patient, just look straight ahead. He says now when he sees the wiggling finger. And so again, you start with superior,
Temporal,
Nasal.
nasal.
Inferior.
okay. Make sure you remember the angles. Okay, so that's for the
So what
optic
was it?
nerve.
50,
90.
50, 90,
90,
60.
60, 70.
Okay, so next we do the oculomotor test.
Wait,
Well,
you did both eyes. first.
Yeah, I did both eyes already. Okay, so you do now the oculomotor testing, and the first test, no, stay there, will be to assess the pupillary reaction. Okay, so the lights should be dim. Okay, so there are three parts of this pupillary reaction. What's that?
The right.
Direct. So I shine the light on the left eye. I check for the constriction on the left. Okay, so for consensual, what do I do?
Shine here, check here.
Okay, so I shine the light on the left eye. I look for the constriction on the right. Okay, and then we do it on the right eye. Okay, my pen light is weak. So that's direct. Consensual, I look at that other eye. Okay, and then for accommodation, what do we do?
Move it towards
Something
him.
like this.
Okay, but you have the light, you shine it, okay, until it comes closer, so you'll be able to see the pupils, they start to constrict, and the eyes, they move towards the midline. Okay, that's accommodation. So what is the normal pupillary reaction? Normal pupillary reaction.
What do you mean, like dilation or
Yeah.
constriction?
What is the normal?
Oh.
2 to 4 millimeters. Equally responsive to light and accommodation. Okay, so you have oculomotor nerve. And then we have for cranial nerve 3, 4, and 6, oculomotor, trochlear, abducens. Okay, so here we ask, this is for the 6 cardinal fields of gaze. Do I have to ask the patient to cover one eye for the 6 cardinal fields of gaze?
No.
Yes.
No. Okay. So we ask the patient, just look at this. Okay. Do not bring it too close. Okay. And then tell the patient, do not move the head. Just follow this with your eyes. Move the head. Okay. So that's the 6 cardinal fields of gaze. Cranial nerves 3, 4, and 6. Next, we have the trigeminal. So for the trigeminal, we have the corneal reflex. So for the corneal reflex, just can you please look sideways? Okay. Stimulate now the cornea. His eyes are very small. It's supposed to be not the cornea, not the eyelash. Okay. Okay, and there is that blink reflex. So do this on the other eye. Again, now look on the, okay, so that is the blink reflex. You stimulate the cornea, patient blinks. Okay,
What's cranial nerve 5?
yes, that's one. And then you have light touch. Okay, so please close your eyes. Okay, so this is light touch. Okay, I will apply it to certain parts of the face. You point to where you feel it. Okay?
Mhm.
Okay. Okay, that's for light touch. And then we have the sharp against sorry, sharp against the dull sensation. So again, you have to give your patient instructions. Okay, so this is sharp. And this is dull. So again, I will apply it to different parts of the face. Tell me if it's sharp or dull and point to where you feel it. Okay?
Okay. It's dull.
Okay.
That's dull. That's sharp.
Okay, all over the face. Random. Okay, so this is sharp against dull sensation. You have the trigeminal nerve. And then for the motor component, like we said, just ask your patient, can you clench your teeth? Okay, and feel the masseter. Okay, so it's symmetrical contraction of the masseter muscles. Okay, then we have the facial. So the facial nerve, there are again two components, sensory and motor. Okay, so we ask the patient, close your eyes, okay, lift your head a little and then stick out your tongue. So I will let you taste two different substances, okay. Lift your head a little, Richard, so it's not going to, okay. Is it?
Wait, is it sweet? I don't know. It's like
Okay.
water. I don't know.
Is that bleach? Right.
Okay, so that is sweet. Okay. Okay, hold on. Drink this first.
Oh.
So in between, you have to ask your patient to take a sip of water. This is clean water. The disposable cups are clean. Okay. So that it won't dilute the second substance. Okay. Don't worry. During the actual exam, I will have 3 different substances so that you have a choice. Okay. Didn't go to the grocery yesterday. Didn't get the chance. Okay. So again, close your eyes. Stick out your tongue. Okay. Lift your head a little. Okay.
Oh, that's salty.
So,
He
water.
wants more.
Okay. So that is for the anterior 2/3 of the tongue. Want some more water?
No.
Okay. Anterior 2/3 of the tongue, facial nerve. And then we have the different facial expressions, like we said. Okay. You have, when you're assessing it, you're standing in front. The reason why I'm here is so you'll be able to see it. So give
So
instructions.
even the masseter thing, you're